Hello, this is my presentation on bipolar and psychosis as depicted in Shameless. So throughout the show Shameless, it follows one of the main characters named Ian Gallagher, who is diagnosed with type 1 bipolar with psychotic episodes. He is diagnosed after being hospitalized due to a really bad depressive episode that we will talk about a bit later. But he does go through multiple manic and depressive episodes throughout the 11-season run. So approximately 9 years is shown the struggles. However, he does not go through any rapid cycling, as most of his episodes do last for a couple months, and then there's a period of stabilization afterwards. Some signs and symptoms of bipolar include mania and depression. So for bipolar type 1, the main two stages are mania and depression. So mania consists of heightened energy, creativity, and social interactions. It shows through reduced need for sleep, so sleeping very little but still feeling extremely energized, as well as more risk-taking behaviors such as impulsive spending and unsafe sexual activity, extreme elevation in mood, as well as an increase in physical activity, which is uncommon due to the lack of sleep, but they still have so much energy that they are able to have increase in physical activity. Depression is another stage, and it consists in feeling uselessness, hopelessness, and despair. This can impact sleep, eating patterns, energy levels, motivation. They stop doing activities they once enjoyed, and as well, it also impacts the cognitive functioning. So mania and depression can last for weeks to months at a time, as well as periods of stabilization that can occur in between. So they could be feeling normal, and then all of a sudden a period of mania may begin. Nothing has to trigger these periods, it just can come out of nowhere. So mania depicted through Ian Gallagher, he does do a lot of very impulsive and unsafe activities when he's in a state of mania because of his heightened energy and his elevated mood. So in one episode, he steals his partner's baby and goes on a road trip with the baby. Luckily, the baby is safe, but Ian did not do any adequate planning for the road trip. He did not bring food or water, and he did not have enough funds to deal with childcare. He also is seen dumping his pills, which is a common sign of people who do suffer from bipolar or psychosis. When he is feeling better and feeling more stabilized, he feels no longer the need to consume his medication, and so he does dump his pills down the toilet. He also participates in other impulsive decisions, such as signing up for their army and then impulsively leaving it. After indulging in some reckless behavior, he steals a helicopter for no apparent reason, and then instead of dealing with the consequences, just leaves because he doesn't really fully understand what's going on, and he's feeling so good that he doesn't really feel the need to deal with the issue that he had just created. He also at one point believes he's the gay Jesus and has very close religious ties, which is also a sign of psychosis, but we will talk about that later. In the show, he also goes through some unsafe sexual practices as well as substance use. So he gets hired at a club to work as a bartender, and then inside this club, he decides to hook up with many of the customers, and in the club as well, he is partaking in a lot of substance use, so consuming a lot of drugs that he is offered or can buy or can find, which is all very unsafe practice. His depression throughout the show is very apparent as well. When he goes through his depressive episodes, he is just seen laying in bed, not being able to get up. He is oversleeping and not being able to eat or maintain his activities of daily living. So he can't get up to shower, go to work, brush his teeth, see his friends. Any normal activities that he would normally be partaking in, he's unable to. He's also feeling deep feelings of hopelessness and despair and loneliness. And then there is an attempted suicide, not by him, but through his mother, who we'll talk about a little bit later. Some signs and symptoms of psychosis. So psychosis is a period of psychotic behaviors, including hallucinations, delusion, and agitation. It can be shown as disordered thinking, speech, and behavior. And Ian does show signs of psychosis as well throughout the show. This can be shown in many different hallucinations. So early on in the show, he does hallucinate that there are people breaking into his house because the government is tracking him and trying to get him. And he can see one morning waking up in a very panicked state and checking the door and the windows to see if there's anybody outside. He grabs a baseball bat and starts swinging, believing that there's somebody out to get him, and almost injuring one of his other siblings. He is also easily distracted and has very sporadic and irrational speech. A lot of times what he's saying makes no sense, and it doesn't really align with his normal personality. This is also shown in his obsession with the church. He takes a very intense position within a church, believing that he is leading these people and freeing them, and that he was sent down as the Messiah. And another very common sign of psychosis is an inability to maintain social cues. And one way this is shown is through lack of blinking. So when Ian is going through these psychotic episodes, you can see that his eyes are quite wide all the time and he does not blink very often, which is a very nice touch that was added by the producers and the actor. So some risk factors for Ian, one of them being genetics. So as mentioned earlier, his mom is also diagnosed with type 1 bipolar, and she is also seen going through many manic and depressive episodes throughout the show. So she is seen being highly impulsive and doing things like leaving the family and coming back. She has an attempted suicide, which is quite traumatic for all the family members. And yeah, she has passed on the gene to Ian, and so that is a big risk factor. He also has a very big stress vulnerability levels. So they grew up in a lower social economic status. They grew up quite poor, and then Ian does go through quite a bit of traumatic episodes growing up. So his father is an alcoholic and an addict, and both his parents did not take good care of him and his siblings as like a child. Was very neglected and verbally abused, so that can also impact it. And we also see quite a bit of substance use at an early age, specifically cannabis, which could have increased his levels of risk for psychosis. Some protective factors that he has is his family support. Those parents were not very supportive. He has his siblings, both older and younger, that have been very supportive throughout his struggles, as well as his partner, who is shown in the picture. He also does take medication throughout the show. When he is taking the medication consistently, it is quite effective. And as mentioned earlier, his family and partner supports are there, so they also help him with his medication. And then Ian also has multiple jobs throughout the show, so that keeps him in check and helps him maintain daily living activities. So, is the show an accurate depiction of bipolar disorder with psychotic tendencies? I would argue yes. The show shows the hardships and the pain of bipolar. It's not at all glorifying it, and it really shows like the ups and the downs and both the goods and the bads that come with the disease. I do appreciate how it also depicts both Ian and his mother and shows the genetic factors that could be tied into bipolar disease. So we get two different perspectives of the disease and two different ways it could be presented in a person. It also shows the likelihood of developing mental illness due to your circumstances growing up. So as mentioned earlier, Ian goes through a lot of adverse childhood experiences, and that plays a role in his mental health. Because the family also is in a poor neighborhood, they grew up in the south side of Chicago, and they have a lower social economic status, it shows how hard it is for him to access proper resources. He does not get counseling. He does not get any like proper help. He does get taken to the hospital at one point in the show, but is only there for 72 hours, and is not there long enough to be stabilized properly. So the second he gets discharged, he does flush his pills, as mentioned earlier, and he did not have enough time in the hospital with the care that could have been provided. So yeah, I think 72 hours was definitely too short of a time for him to be in. It would have been helpful if he had more time and more supervision. And the show just also shows how risk and protector factors play a huge role. So we see that when Ian has more supports, like his friends and his family, he's doing better. But when life gets busy for them and they can no longer be there to support him as intensely, he does struggle more. We also see how when he is using substances or not taking his medication or going through hard times in life, such as breakups or deaths, he does struggle a lot more and his symptoms can show up. So I overall think the show does a really good job of showing accurately what living with bipolar is like. Thank you.